As everyone who is very serious about taking care of patients with advanced prostate cancer, starting with those who fail localized treatment and progress to a requirement for androgen suppressive therapy, invariably these patients will convert from an androgen sensitive state to what we now describe as a castration-resistant state. And the good news is since 2010, we've had 5 new therapeutics approved really almost worldwide. One of the challenges is that it's not necessarily available in all countries, so accessibility and cost is part of it. Additionally, there has been a sort of a stepwise approval, and so some areas of the globe are getting a sooner rather than later experience with the therapies. Now, even with that, and in parts of the world that have access and early approvability, these therapies have come out almost one on top of each other. So there really is a true paucity of sequencing data, of combination data done in any large prospective manner. There are multiple single institution studies. There are many investigator-initiated trials, which I myself have been part of. So we're trying to first and foremost understand the adverse event profiles of sequencing and combining, but then ultimately the outcome analyses. And as we move more and more into a world of economic utility, this has to be very much a part of the discussion. So we have 2 taxane-based therapies in castration-resistant prostate cancer. We have a unique radiopharmaceutical. We have an immunotherapeutic, which is only available in the US, and 2 oral novel hormonal lines of therapy. I think in the foreseeable future, we may see other immunotherapies that work their way into the treatment algorithm for CRPC. We're certainly seeing many new immunotherapeutics in bladder and renal metastatic disease, which is extremely exciting. And we're also now looking at additional oral therapies known as DNA repair mechanism approaches, or the PARP inhibitors. So it continues to be a very exciting time, but yet a more complex and to some extent a confusing aspect for clinicians who are devotees of advanced prostate cancer. The multidisciplinary approach is extremely important, whether it's a medical oncologist, a urologist, radiation oncologist, ideally everyone. And it's important that the patients understand that they get a full patient-physician shared discussion so they can make the best and most informed choice.